Hello, my name is Gretelis. I'm 26 years old. I have two small children, and I have SMA type 3. I would like to tell you about my life a little bit, how I was diagnosed, how SMA has affected my life and my family's life, and how I finally got treatment. So, about my diagnosis. SMA is hereditary. I was born with it, but I wasn't diagnosed until I was 14. My brother has the same disease, but he was diagnosed when he was 2. In my case, and the disease expressed at a later age, and it was the symptoms weren't very severe. I remember when I was in a PE lesson in a primary school, and I thought why I couldn't run as fast as my classmates. So this was the first time I noticed that I was lagging behind. Later in basic school, I couldn't run anymore, and I had difficulties in gymnastics. My PE teacher tried to explain to me that it was all in my head. I could jump over things, but I was afraid of it. But actually, I just didn't have the strength. I remember that everything clicked when one of the girls in my class asked me, Gretelis, why are your hands shaking? And I didn't know what to answer her. I also remember when one summer we were jumping on a trampoline with my friends and we were doing different tricks. One of them was sitting cross-legged and then jumping up without helping with hands. And for my friends, it was very easy. I tried and tried, but I still couldn't get up. The same summer, I talked to my mum about the things I had noticed about myself, and then I had to undergo tests. My mother hadn't suspected once before that I could also have SMA. But as soon as she saw me undergo tests, she understood that this is the way things were. From the medical tests, I remember I had to walk on my toes and on my heels. Then I had to squat and stand up, and it was very hard for me. The worst thing was a procedure where they were putting needles in my arm and thigh muscles, and then I was asked to squeeze the muscle. As if this huge needle wasn't enough, I also had to squeeze the muscle at the same time. It felt horrible. After I was diagnosed, I remember that a doctor saying that if I want to have children in the future, I'll have to go and get myself tested first to make sure that I wouldn't give this disease to my children. I had to think about my future and my children at the age of 14. At the time, this was a disease that couldn't be treated. It was a proper blow for a 14-year-old. I remember that the doctor told me that I probably wouldn't end up in a wheelchair, but I knew what it would actually mean. My brother found himself in a wheelchair about a year before I was diagnosed, and this was not a quick transition. I can't remember much else about being diagnosed because the brain has the wonderful capability of forgetting trauma. Sometimes people feel how old they feel they are, or at which point they stopped aging, and I always said 14. Usually, this age depends on a trauma that happened at some age. And I couldn't explain why I felt like this, but now, after having started treatment and having analyzed myself, I understood what the trauma was. It was the diagnosis. How has SMA affected my life? The my thigh muscles are most severely affected. I have difficulties with running, squatting, jumping. This is a progressive disease, so I feel it in my arms and my hands, in my stomach and back. I found out in school that I can't run and squat, so I have avoided sport throughout my life. I have told myself that I don't like sport because this is easier than admitting that I cannot exercise as people around me do. But this doesn't mean that I haven't tried. I really like dancing. At school, I tried folk dancing and also Zumba and street dance. But when you can't do the choreo, then it's it's difficult because I don't look like a sick person. So people assume that I should be able to do the same things as others. And of course, I won't be telling everybody that, actually I'm ill, so I can't do the moves. When I was thinking about my career, I excluded automatically several occupations, for example, a surgeon, a painter, and so on. I actually didn't pay much attention on education because I wanted to focus on children. I knew that if I wanted to have children, I had to do it early. I was active in the Estonian Defense Union. I was in. I have also been very active in the Women's Home Defense Union. But I cannot be very active there. I cannot participate in hikes and other physical activities. So I have been doing office duties. When we renovated the ground floor in our house, I could try painting the walls, and we renovated the ground floor because the older I get, the more complicated it is for me to take the stairs. Right now, it's very difficult to walk in the street because it's so slippery. It's also very difficult for me to use public toilets because the toilet bowl is very low and the booths are very, very narrow, so I really don't have a lot of space there. I have SMA type 3, as my brother. As I told you before, he also has SMA type 3. However, his condition is a lot worse than mine. I read that for men, SMA could be diagnosed at an earlier age, and it's more severe. He was diagnosed at the age of 2. I was 14. When he was 23, he was in a wheelchair. I am 26 and I'm still walking. On the one hand, it's good that we can talk about the disease. On the other hand, it's scary to see what a disease can do to a person, how it slowly progresses and takes more and more freedom from you. The doctors predicted that I wouldn't end up in a wheelchair, but I have seen how difficult life can be before the wheelchair. So it gives me no comfort that I won't end up in a wheelchair because my movement will still become more restricted and more difficult, but not enough to get me in a wheelchair. If I was the only person with SMA in my family, my life would be very different. I would have more self-pity. And maybe I'd also feel more ill. But seeing how my brother is coping with the disease and how healthy is his attitude to life, I can't waste time on self-pity. I have to move on with my life. I do feel a bit guilty because as if I wasn't entitled to complain because it's so much worse for him. But if you compare me with a person who is physically well, then I am actually in a uh, worse condition. Now, when the Children Foundation started to pay for my treatment, then I got the imposter syndrome because my brother would deserve this treatment a lot more than me. Of course, this doesn't mean that I don't need treatment. And right now, I am in a better condition than he is. It's a progressive disease. So we have to sit and wait until it gets worse to be entitled for treatment. And then maybe people would notice more and I would be a bigger burden for the society. SMA also affects my family life. As I said before, in order to be a good mom for my children, I had to have them as soon as possible because, I mean, so I had to get a husband because you can't have children alone. So I had to find somebody who loved me the way I was. He was happy with my life plan. He loved me the way I was. Before I got pregnant, my husband had to undergo a genetic test. We got a green light from there. Our genes were fine, so we wouldn't give this disease to our children. After the birth of our children, we can see how much he has to do by himself. He has to carry the bags, he has to move the furniture, he has to play with the children and lift the children. Sometimes I can't even wash my baby because I have no strength to hold him on my arm. The most painful moment was when I saw my smaller child screaming from joy because her daddy lifted her up. But I didn't have the strength to lift my little baby and make her laugh. I can't model a healthy life for my children. We can't go hiking with the family. We can't do anything like this together. Of course, I can tell them that it's important to move and they can do the things with their dad, but it would be wonderful to do all these things together with both parents. I have always dreamt of living in the country, having my own house, my own garden, but this would also mean taking care of the household and hard physical labor. So this is another dream I have to bury unless my husband agrees to do all the chores by himself. When I finally got treatment, so the first time I heard about this treatment was when I was pregnant with my second child, and I heard about it from my midwife. So I phoned my brother, asked whether he had heard anything about this treatment. Well, I wouldn't have been able to start the treatment during my pregnancy, so I didn't really inquire more information about that. After the delivery, I was asked to the genetics clinic in Tartu about the potential treatment. I heard about the financing of this drug in Estonia. The health insurance fund only supports people who are under 26. I am 26. So, in the eyes of the health insurance fund, I'm too old. There were other 3 people who were left untreated because of this age limit. One of these people is my brother, and I don't know what's the justification of the health insurance fund. I work, my brother works, we participate in cultural events, we pay taxes, we are citizens who contribute to our country. And if you don't treat us, we will be a burden to the society. If you treat us, we can contribute more and for a longer period of time. Thanks to the Children's Foundation, I have been receiving the treatment. I have been taking the drug for over a month, and I have noticed improvement during this short period of time. First, they told me that the medicine prevents the progression of the disease, but actually we can see that actually it improves both my physical and mental state. From the mental perspective, I feel as if a burden had been lifted from my shoulders. I don't have to plan every single action every day so that I could uh, uh, finish the day. From the physical perspective, there are fewer changes. This disease is creeping along in secret, so my capabilities come back very quietly. So it's very difficult to remember the things that I used to be able to do or I wasn't able to do and things I can do now. But I have noticed that I am able to lift my baby now, and this makes her laugh, and I can see her laughing every single day. So if you ask me how old is too old not to be treated, then I hope that 26 is not this age. Thank you, Grete-Liis, for sharing your story. Thank you so much.